Hi, I'm Dr. Michael Steinberg, Medical Director of Cardiothoracic Surgery here at Memorial Hospital in South Bend.
Hi, I'm Shakir Aslam, one of the interventional cardiologists with Memorial Advanced Cardiovascular Institute.
Well, I guess heart valve disease can be insidious, and so it is possible to have significant valvular disease of the heart, and for you or your primary care physician to maybe not even know about it. And so valvular disease can sneak up on people, and it can be a lifelong disease, and it very slowly damages the heart usually. And those are the kind of diseases that are really problematic, because oftentimes by the time you're sick enough to come to a hospital or go to an emergency room, much of the damage has already been done. And so I think one of the big reasons for us all to be concerned about valvular disease is that it sneaks up on you. And it's very important to try and catch those problems early on. And if they can't be caught early, sometimes they can be treated very easily, sometimes just with medications only. Sometimes it requires surgical intervention. But valve disease can and does cause irreversible changes in the heart. And if we get to it too late, sometimes the problems can be very difficult to fix. And so that's what would concern me most about valvular disease.
And I think also we should mention that it may be medication or surgery, but a lot of time it could be just risk factor modification like weight loss, smoking cessation, eating healthy, exercise, and some of those things. So that can also prevent some of the damage to your heart valve. And one of the other things we should mention that some of the conditions like severe aortic stenosis, once you develop symptom, your risk of dying within the next 1 to 2 years could anywhere be from 15% to 50%. So you don't want to get to a point where you have symptom and you have risk of dying from that valvular heart disease. So you want to catch it early and get it treated at an appropriate time. In this day and age, anyone could have valve heart problem. Some of those are just, they come with aging. As you get older, and people are living longer and longer. As you get older, some of your valves start to get narrow, like especially the aortic valve. It start to develop calcium on it, and they don't open it fully to get the blood let out of the heart. So really, anyone could be at risk of heart disease. Some of those people are born with congenital heart valve problem, but some of them acquire as they get older, or they get any other kind of heart damage from heart attack, or blocked arteries in the heart, or high blood pressure, or high cholesterol, or smoking, or obesity. So anyone could have a heart valve problem, without having any risk factors.
Yeah, I think certainly advanced age, the older we get, the more likely all of us are to have problems with things like aortic stenosis. But there certainly are things that people are at risk for because of their genetics. People that have a history of bicuspid aortic valve disease, so anybody that has a history in their family of having aortic valve surgery or aortic valve replacement at early age, they are at increased risk to have aortic valve problems. People that are born with congenital heart defects, as you mentioned, certainly are at a much increased risk to have a variety of different valvular diseases. And people that have been told they have a murmur. Many murmurs are innocent and are inconsequential, but there are many people walking around that have been told by their family doctor, oh, you do have a murmur, it's probably nothing. In my opinion, I think if you have a murmur, it probably warrants taking a close look at that. At the very least with an echocardiogram, if not with evaluation by a group like the Valve Clinic here at Memorial Hospital.
And at the same token, Mike, we should also mention, many years ago, the diagnosis of mitral valve prolapse that was so common that almost half of the people, are walking around with the diagnosis of mitral valve prolapse. But the definition of that has changed over the last few years, and a lot of people who are diagnosed with mitral valve prolapse in the past, they truly don't have mitral valve prolapse. Right. So some of those patients could be evaluated, and so they're all this time living with a fear that, oh, I have mitral valve prolapse, but they may not have some of those. So some of those questions could be certainly answered, in the heart valve clinic. Typically, they'll call the valve clinic to schedule an appointment. So one of the coordinator will call them and ask them some of the initial questions. They'll try to get records, what they have already available, and they'll go through those records, and try to get some of the testing done ahead of time before the patient comes to valve clinic. And after all those things are done, then patients come to valve clinic where the patient is seen by the clinic coordinator first and get the initial history and some of the vital signs and other things. And then, Dr. Steinberg and myself or any of the cardiologists who are in the clinic that day, they will go and talk to the patient and evaluate and discuss with them, both of them being in the same room, so they can answer all the questions, whether they're related to medications or to surgery or any of the other care. And also, if they need any additional testing, a lot of times that could be done the same day, so they don't have to come back, for some of those tests at other time.
Yeah, I think there's several unique things that you can expect on the day that you come to the valve clinic. Number one, as Dr. Aslam said, you're given a personal patient care coordinator, and that person is an advanced practice nurse who follows you through your entire time at the valve clinic, which could be just one appointment or could be multiple appointments down the road. And they're very helpful about coordinating care, setting up for any testing that might need to be done, which can sometimes be cumbersome for patients. And so this really makes it a lot easier to have that go-to person that can really guide you through the whole process. And then I think the second big unique aspect, as you said, is that you can expect to meet both a cardiologist and a cardiothoracic surgeon in one setting, without going to another office, without having to wait in another waiting room. You see all the specialists that you need to see all at once, and so you get a team of different specialists putting their heads together to provide you with the best possible treatment care, or best possible treatment plan, and it's given to you all in one visit. And so I think it's really quite unique, and we're really excited to bring that to Michiana.
And Mike, we should also mention that sometimes they also need some additional testing where we might have to involve the interventional radiologist or the echocardiographer or some of the other clinicians as well. So they're all available in the hospital while we're seeing this patient. And if we have any questions, they can also come and talk to the patient and give their opinion. So it's really a multidisciplinary approach. It's not really a cardiac surgery or cardiology. It involves a whole lot more than 2 or 3 physicians. It's involved the whole system.
Absolutely.
So I think being in the hospital, being in the clinic, where everyone is available in the hospital at that time, it makes it much easier for the patient and for the care. This is the only heart valve clinic in this area, so it has been started and tried in a lot of bigger cities and bigger institutions, but in the towns of our size, this is one of the first initiative that we have taken up, and this is the only heart valve clinic in this area at this time. Mike would actually, say it more than I could, because sometimes patients they have misconception or misperception. Some of the patients, they don't even know that what Memorial Health System or the local cardiac surgeon can offer in this area. It's amazing that some of the people say, well, open heart surgery, I don't know if it's done locally. They'll just look it up and go out of town, and then later on find out, oh, this could have been done locally, at close to my home and close to my family. And I think one of the other important things we have to emphasize here, that as Mike said earlier, that it's a continuity of care. Once you have surgery, you're not done. You need a long-term follow-up. So if you have your treatment done locally, you have a cardiologist and a cardiac surgeon they can go to for follow-up long-term, and so you don't have to make multiple trips out of town.
I think the one thing I would say to patients is that there is no one perfect place for every problem, and there are certainly situations that are better handled at a larger institution, say in Houston, Texas, than they are in South Bend. That being said, the majority of heart valvular disease is very capably handled right here And I think this valve clinic is a good expression of that expertise that we have right here in South Bend. There are certain interventions. TAVI, or minimally invasive percutaneous aortic valve replacement, is currently only available in select institutions around the country. And certainly part of what we do in the valve clinic is evaluate patients for their candidacy for that. And so there are situations where we say, hey, you'd be best served at University of Chicago to get a TAVI procedure. So there's no one perfect fit for every situation, and I think that's one of the reasons to have this valve clinic in the first place, is to really have multiple specialists come together to see what the best fit is for your problem. And so I think it's a mistake to say, well, I need to go to San Diego to have my valve taken care of without being evaluated first. I think at least talking with us and getting our opinion about what the best fit is for you is really a great first step.
It's a community-wide initiative. So if you already have a cardiologist, you can ask them, do you go to valve clinic and can I see the surgeon with you at the same time, rather than having two separate visits. So all the different cardiology groups, they are part of this clinic. All the different surgical groups, they're part of this clinic. Nobody is excluded from them. So you don't have to change your cardiologist or your cardiac surgeon. So it's just the community effort. It's just for the benefit of patients. So nobody's excluded. So it's really a community-wide effort.
Yeah, I think valvular heart disease is a complicated medical issue. And it oftentimes requires a variety of tests to assess what valve problem you have and how severe it might be. And so that being said, I think it's most easily facilitated to have a physician referral to our valve clinic, because oftentimes we can get a better sense of what testing might be necessary before you're seen in the valve clinic. But it's not a requirement that you be referred by a physician, and certainly if your physician doesn't come here, or if you're not comfortable in speaking with your physician about coming to the valve clinic and would like to refer yourself, we would accept that. But it's certainly, I think, made the easiest done with a physician referral.
And I think we should also add to this that sometimes you might just come for a second opinion. You might have already seen a cardiac surgeon or cardiologist, and they might have given you some opinion. And if you just want to have a second opinion, which may be the same opinion and make you more comfortable, so you can just come and talk to us, and opinion may be the same, and then you can go back to your cardiologist and cardiac surgeon, and so at least in your mind you'll be more comfortable that you're getting two different opinions with the same recommendations. So
it's a great point.
I think one of the things I definitely would like to emphasize, that heart valve clinic or the heart valve disease could be completely asymptomatic. You may have heart murmur for years and you may not have any symptom. Sometimes your physician will tell you to get certain testing done in 5 years or 10 years, and you may have completely ignored it or forgotten about it. So if you come to the valve clinic, we'll at least follow up on some of those things. If we tell you that you need another echo or another evaluation in 3 years or 5 years, we'll call you in 3 or 5 years and make an appointment to make sure that you do get evaluation, because you don't want to let your valve problem get to a point where it might be too late to treat it. And we should also emphasize that some of the patients that we thought in the past they were high risk and they're too old to do some of those surgeries. Now we have seen that some of the improvement in technology and surgical skills, some of those patients also benefit from those surgery, and some of those patients, they live longer, their quality of life gets better. And over the last 5 to 10 years, a lot of things have changed. Some of the things that we waited too long to treat, now we can get them taken care of at an early stage. And not only that, sometimes these patients need surgeries or medication, sometimes maybe risk factor modification. They might be candidate for minimal invasive surgery, and they might be candidate for some of the percutaneous procedures. And if they are candidate for some of those procedures, we can do a lot of their earlier workup and screening at this hospital, at this clinic, and then refer them to the appropriate place, rather than having them go to different tertiary care centers for all the simple stuff that could be done locally, and avoid them, save them a lot of trips.
Yeah, just to reiterate, valve disease is insidious, and you only have one heart, and once you have irreversible damage, it's irreversible, and so it's imperative for patients, family physicians, cardiologists, surgeons to intervene before irreversible damage is done to the heart. And that's really the whole reason that this exists, is to protect your heart, because damage can be done without you even knowing it. And that's our job, is to figure that out and find that out as soon as possible and take care of it.